the infection becomes more chronic, it will kill the bone. When you have a dead bone, it's chronic osteomyelitis. Dead bone is also called as a sequestrum. Sequestrum in English dictionary means isolated in a cavity. So you have a cavity. In between that, you have a dead bone. Whenever there is a blood supply to the bone, it makes it porous, creates osteopenia. More blood supply, more osteopenia. Less blood supply, bone will become more white, radio opaque. So sequestrum looks white on X-ray. So it is light and white. This sequestrum is surrounded by infected granulation tissue in cases of chronic osteomyelitis. Outside the sequestrum, you have the live bone called as the involucrum. So involucrum is the live bone, and then you have draining sinuses which start from the center, travel through the involucrum, called as cloacae. The cause of the sinus is the sequestrum. Complications. Infection should be optimally managed. If not, it can lead to amyloidosis or malignancy. In a chronic process, the malignancy that sets in is squamous cell carcinoma. What I have just drawn, I am showing here. You can see here in the center, the bone is deformed. You have sequestrum in the center of the bone, surrounded by involucrum. Many a time they throw an arrow on sequestrum or involucrum to ask you what these parts are, or you can have draining sinuses called as the cloacae. Another image, they will give you a spot diagnosis. Deformed white bone, chronic osteomyelitis. Upper and humerus, you can see a cavity, white shining bone. When this white shining bone, the dead bone, is surrounded by involucrum, it's like a rim all around. So the rim in chronic osteomyelitis is picked up on MRI. Picked up on MRI. When you have continuous chronic osteomyelitis involving large segments of the bone called as Gary's sclerosing osteomyelitis, it's a variety of chronic osteomyelitis, involves the mandible followed by the tibia. These chronic infections or chronic osteomyelitis of the bone, number one treatment, remove the dead bone. Number two, but the most significant, control the infection. Number three, fill the gap. So whenever you have a gap in the bone, you must fill it with a bone graft or a bone cement. Bone graft in human body is usually taken out from the iliac crest, and the bone cement, you must all remember this name, polymethyl meth acrylate. Every white structure in human body, it should be covered with a soft tissue. Brain, white, cover it. Spinal cord, white, cover it. Bone, white, cover it. Cartilage, white, cover it. Vessels, white, cover it. So soft tissue coverage is of paramount importance. And then one of the way of doing a soft tissue coverage we'll talk about is a vacuum assisted closure, also called as negative pressure wound therapy. This is what is a surgical pick. You have dead bone. Dead bone will not bleed. Whatever bleeds, whatever hurts is alive. So you will cut through the dead bone till what time? till the time you start noticing the bleeding points called as a paprika sign. Stop here. Otherwise, the integrity of the bone will be gone. You will have pathological fractures. This is what tells you about the end point of the first step of treatment, remove the sequestrum. This is one of the common instruments in orthopedics, bone nibbler. This is again a very important instrument, bone cutter. This is what is negative pressure wound therapy. Debride the wound, dress it, occlude it all around, make a hole, connect to a pump, small pump, which patient can carry home, called as negative pressure wound therapy or vacuum assisted closure. It enhances the healing by formation of the granulation tissue. You can have a negative pressure continuous or intermittent. But remember, what is the range of the pressure? Minus, we are in negatives, 75 to minus 125 millimeters of mercury. You are enhancing the proliferation. Contraindication, malignancies. Untreated infection, necrotic tissue. This spot diagnosis is very time asked to you. This is long bone sclerose infections. Newborn is a state of immunodeficiency. That is why the infections will involve multiple bones. The clinical signs will almost be not there. Staph aureus, commonest organism. Spread of infections is always hematogenous. Metaphysis, commonly affected, difficult to diagnose. Clinical signs are almost not there. That is why prognosis is poor. If you have chronic, recurrent, multifocal osteomyelitis, one such example is SAPHO syndrome. SAPHO is an autoimmune disorder. It is HLA-B27 positive, just like ankylosing spondylitis, where it has sacroiliitis. You have synovitis, acne, pustulosis, thickening of the bone, inflammation of the bone. So it's not osteomyelitis, it's osteitis. One basic point I want to tell you. When you have multiple bone involvement, multifocal osteomyelitis, and they want to know the diagnosis, please answer SAPHO syndrome more than sickle cell anemia. Sickle cell anemia also can be multifocal osteomyelitis. Salmonella is the organism, but SAPHO is classically described. Treatment of SAPHO syndrome is just like autoimmune disorder, NSAIDs, steroids, and disease-modifying anti-rheumatoid drug.